Dr. Priest, back with Dr. Priest from Anchorage, a dentist in Alaska up there where it's cold. Dr. Priest, do you see children in your practice?
Yes, I do.
Wonderful. Do you have any advice for moms who just had a baby and, or maybe the baby is 1, 2, 3, 4 years, such as when should they bring the baby to the dentist, things they should do or not do while the baby is teething or not teething, and any some such little things you can tell to the moms and dads out there about their kids?
Sure, thank you. We like to see a child for the first time when they're about 1 year old. And that's more of a visit actually with the parents. We can take a quick look at the child, but mostly it's to talk with the parents about what they need to be doing, what they shouldn't be doing, to help them so that they are helping their children rather than harming them as far as their oral health goes. And then when their child is about 3 years old, oftentimes at that point they're old enough we can have them sit still long enough to take a look around and get a quick look. Usually at about age 4 you can start to have them sit still long enough to clean their teeth. And sometimes 4 and 5, they're old enough we can start to take x-rays. So if they have had some good experiences as they're little, then they're not scared of the dentist and they do better as they start to age. What's hard is when a child comes in and hasn't been into the dentist and they're 6, 7 years old and that's their first visit. Sometimes they can be quite upset at that point. So if they start at an early age, it's better. The one thing that the parents, is the teeth are coming in with the young child, they should initially just wipe the gums, get in the habit of wiping the gums with a wet cloth so the baby's used to having someone in their mouth cleaning. And then as the teeth start to erupt, they can use a soft little baby toothbrush and start to brush the teeth just with a wet toothbrush. They don't necessarily need toothpaste at that point. Just the brushing action of the bristles is what does the good. And they can introduce toothpaste later on. One interesting thing that has come to light lately is that dental cavities is a transmissible bacterial disease. And oftentimes the reason that the children start to get cavities is they're transmitted from the parents, especially the mother, when they're babies. If the mother has the type of bacteria in their mouth that cause cavities, they can transmit it to the child through kissing or through maybe tasting a little bit of the food before they put it in the baby's mouth, or maybe some mothers might put the pacifier in their mouth first or whatever. That's the way that the bacteria is transmitted to the little babies.
I see. So what is the thing you're telling a mom who comes in with her 1-year-old baby? What are some of the things you tell her? Or, you said it's more to educate the mom and maybe get the baby used to sit in a dental chair, ride with mom up and down, basically a non-threatening visit, and becomes a natural thing. But what is some of the stuff you're telling mom there?
Well, the big thing, like I mentioned, is to be massaging the gums with a wet cloth. But especially don't put the baby to bed with a bottle, with anything in it except water. Any type of juice or formula, that can lead to baby bottle mouth. And the teeth, as they're starting to erupt into the mouth, can decay and rot right from the beginning. So if they can prevent that, that will it'll help a lot.
I see. Well, that makes sense. I mean, after all, we adults, we're supposed to brush our teeth so that there's none of the food rests, none of those stuff is in the mouth. So if you go to bed with, milk and whatever, all the stuff which actually gets rotten and collects bacteria over time anyway, and you have it soaking in it, well, that's worse than not brushing, I guess.
Mm-hmm. Mm-hmm.
Okay,
exactly.
Makes sense.
Exactly.
Makes sense. Is there anything moms can do when the teeth erupt and, the baby always is crying? And are there some stuff out there, gels and stuff, which do help, to make the pain less for the baby?
Right. There's the over-the-counter topical anesthetics like Numzit or Oragel, those type of things sometimes will give the baby some relief. They usually like something soft to chew on to help the tooth break through the gum tissue. And you need to look for things, infections and fevers and that type of thing. Treat those with, your Tylenol and that kind of thing if the baby's getting a fever from the tooth breaking through.
I see. Well, I guess growing pain is growing pain now.
Yeah.
I'm 58 years old and I still don't seem to be finished with my growing pains.
We're growing horizontally now instead of vertically, right?
Yeah, something like that. All right, good. So basically, mom, get mom medicated first, almost immediately. And at the same token, moms should bring the babies with when they themselves go to the dentist so that it's a normal occurrence and the dentist is not some type of monster all of a sudden.
Right, exactly.
Okay, and get the baby used by cleaning the teeth even before they're there, by kind of pressing the gums with a towel and afterwards with a toothbrush, so that the child is used to have somebody in the mouth,
yes.
Basically. Well, all right.
Yes,
Good.
that's right.
Well, wonderful. Thanks a lot, Dr. Priest.